Hi, my name is Sarah Steele, and I'm going to be doing my presentation on the importance of active listening. Many distractors contribute to poor listening habits, such as trying to frame an answer while the speaker is still speaking. This can totally interfere with receiving the entire message. And environmental distractions can also occur, such as crying babies, multiple conversations, and many other things. Some distractions done by the listener that can abrupt conversation would be things such as avoiding eye contact, or even trying to shuffle through papers while the speaker is still talking. You want to follow 3 steps when wanting to actively listen. Listen carefully to know what was said, process the information you heard, and make a decision about what was heard. Techniques used to facilitate active listening can be giving your undivided attention by moving to a quieter area to avoid distractions, providing feedback by rephrasing what was heard, or even giving nonverbal messages such as body language, or you can just respond to them. This listening technique implies the respect for the speaker and communicates a regard for what the speaker has to offer. So essentials that relate most to active listening are essentials 6 and 8. Effective communication and collaboration among health professionals is imperative to patient-centered care. Collaboration is based on the complementaries of roles and understanding of these roles by the members of the healthcare team. Each member may facilitate good interprofessional communication by paying attention to his or her listening skills. Good listening skills can foster good communication while also minimizing misunderstandings. Professionalism is a consistent demonstration of core values evidenced by nurses working with other professionals. These values can include altruism, autonomy, human dignity, integrity, and social justice. Their job is to achieve optimal health and wellness outcomes for patients, families, and our communities. One principle that solely relates to active listening is human dignity. This form of communication allows the listener to fully tune in to what the patient is saying without any judgment towards the speaker. Human dignity is respect for the worth and uniqueness of individuals and populations. When a nurse is actively listening, they are supporting the dignity of each patient by honoring value and beliefs of that person, while also trying to empathize with that individual. Active listening plays a huge role in patient-centered care. Discussing principles of effective communication amongst staff members in order to work on and continuously improve collaboration between team members should always be done. Assessing your own level of communication skills should be done first when wanting to improve communication. Active listening and self-awareness are suggested to be associated with empathy and in turn patient-centered care. Open-ended questions asked early in a patient interview can define what kind of care will be provided to that patient. Key features of patient-centered communication include understanding the patient's perspective of the illness and empathy provided by the listener. So there was a study done on lending an ear to a partner during a coping conversation. Some things used were back channeling, so this can include brief acknowledgments such as or yeah, just to let this speaker know that you are following the conversation. Paraphrasing the partner's message without evaluation or judgment can also be done. Open questions encourage the speaker to further elaborate on his or her personal thoughts or feelings. Listening attentively and understanding the partner's stress can have a great effect on the disclosing partner. Active listeners are perceived as more responsive and supportive by those disclosing partners. Partners are able to feel more intimate when their listening partner is more understanding and responsive. When partners are listening attentively, the speaker is more prone to talk without fear of criticism or negative judgment. Listening, therefore, can be seen as an essential component of interpersonal communication and of relationships more generally.